So, okay. All right, I'm Lowell Sattler, the director of the Washington Hospital Center Cardiac Cath Lab. And the purpose of this instructional video is to show everyone how to use ultrasound to reduce bleeding associated complications by starting off with a better stick. So what we have here is an ultrasound probe connected to a new Abbott Medical Zonair ultrasound peripheral device. And what I've done here is we've prepared with a sterile sleeve the ultrasound probe. I've added sterile gel to the outside, and I'm going to go ahead and orient it so that it's oriented properly with the screen. So when I touch the right side of the probe, it ends up on the right side of the screen. So that way I know left is left and right is right, and we'll go ahead and access the groin. And so you can see here there's a little bit of burnout, and that's probably due to a bubble in the system. So I'm going to try to get the bubble out of the space between the protective seal, the sheath, and the imaging probe. So that looks a little bit better. I'll put some more gel on the outside, and here's a much better image now. So what you see here is dead center we have the artery, and right below that is the vein. And in fact, if I scan down, I'm just looking to see if I can find a bifurcation. And it must be a low bifurcation because I don't see one. I just see the vein, which you can tell because I can collapse it by putting external pressure. So if I push pressure down, the vein collapses. If you could turn on the color, we can see that even a little bit better. So there's the color signals. The vein below, which I can compress. And actually that's the bifurcation of the artery. So if I go up a little bit more towards the patient's head, you'll see those two vessels will become one, and that shows we're right above the bifurcation. That's the best area to stick the artery, right above the bifurcation. So then I'm going to center the probe right over the artery, and then I'm going to take my ultrasound or my regular micropuncture needle, slide it just behind the probe, and as you see, it'll come down and it actually slid right into the artery. Sometimes it's more obvious because you can see the artery dimpling. And so a single wall stick, perfectly placed, which I do think will reduce the likelihood of a bleeding complication when the sheaths are taken out. So now I have the artery. I'm just going to show you the same process through the vein. We're actually using this for all of our diagnostic and interventional procedures, including the TAVRs. If you have the 5 French sheath, we'll just put that over. And this happens to be a patient that we're evaluating for a TAVR, so we're going to do a right and left heart cath, hence the reason for the venous access. So I'm going to do exactly the same thing. Sometimes when the arterial sheath is in, it's a little bit harder to see the vein, but in this case you can see it perfectly. So I'm going to come up, you'll see I can compress it. I'll show you. There's the bifurcation, actually, the two vessels. I can go up a little bit more. So that's the common femoral. And to the right of it is the femoral vein. So what I can do, it's often easier to actually look, to penetrate the vessel with the color off. So we'll turn the color off. I'm going to, again, put the micropuncture right underneath the probe, and then you can see a little bit of an indent. And then enter. It's already coming back, you can see. I'll push the microcatheter wire and we have access to the artery and the vein. It's very quick. It's extremely helpful in patients, particularly patients who are overweight or vessels that are very deep. I think it will substantially reduce your complication rate for both the diagnostic and interventional procedures as well as structural procedures. We do it in every procedure now, just because I think it dramatically improves the safety of the procedure. And we have noticed a huge difference in procedures where there typically is a higher complication rate using large bore access, such as in TAVR. So I would say that our complication rate's been reduced by at least 50%.